5:02. Let's take a look at the COVID situation here in Indiana, and we're starting to see new COVID cases reach a high that we have not seen in months.
Yeah, thousands of new cases being reported, which is a huge jump from recent days here. Well, Karen joins us now with a closer look at the situation across the state, as well as right here in Marion County. Karen.
Yeah, you know, the numbers are not good. Now, statewide, we had more than 5,000 new COVID cases reported. That's what you see here. If you look at this graph here, this is the orange line here. 5,036 cases, and you can see the big jump from recent days here. You know, looking back to the middle of April when the line was just about halfway up, and it just goes down and then skyrockets up to that more than 5,000 mark. Now, again, that was that dotted line we showed you. Now, we are averaging more than 3,000 new COVID cases every single day for the last week. And the last time it was that high was 7 months ago when numbers were falling. Now, Marion County reports about 400 new COVID cases and a positivity rate of more than 10%. Now, the Marion County Public Health Department, they are still continuing with its mobile clinics to encourage more people to get vaccinated. And Dr. Virginia Kane, she gave no indication that she will seek more COVID restrictions in the county, but she is concerned about the rising number of cases among children and says adults must do their part to protect those who are not eligible to get the vaccine yet.
I think a lot is going to depend on what happens in this next 30 days in terms of how many people we can quickly get vaccinated, how many people are using these other mitigating procedures such as wearing masks when out indoors and doing social distancing. I think it could have a tremendous impact on us finally slowing the rate of rise of these cases.
Now, Dr. Kane says 98% of people in Marion County being hospitalized were unvaccinated. Now, slowing cases is the goal in order for us to get far below that 10% positivity rate, Julia.
Thank you so much, Karen. A reminder, you can always find the latest COVID information, including all the stories that we've done here locally on the virus at WTHR.com. Also, they're posted for you on our free news app.
And Moderna is now asking the FDA to fully approve its vaccine for people 18 and up. This comes after the FDA fully approved Pfizer's vaccine on Monday for people 16 or older. Moderna is also asking for a priority review, but something like that could take months. The company has asked the FDA to grant its vaccine emergency use in people as young as 12 years old.
And if you got the single dose Johnson & Johnson vaccine, keep in mind that it is likely you will be getting another booster shot. Johnson & Johnson says their latest study showed that people who got a booster shot 6 months after the initial dose showed a 9-fold increase in antibodies. Health leaders say your immunity will eventually wane and leave you more vulnerable to infection, even if you don't get a booster. The Biden administration has recently recommended boosters for those of you who got either the Pfizer or Moderna vaccines. And news from the Pentagon shows that they've ordered all military service members to get the COVID vaccine immediately. More than 800,000 service members haven't been vaccinated. Soldiers will be able to get their Pfizer shots at their bases and from their commands around the world. The Pentagon has said it has enough vaccine supply to meet that demand.
Time now 5:06 on this Thursday morning. In your morning rush, Franciscan Health is changing the location and process for drive-through COVID testing. You'll now have to stop by the Southside campus off of Emerson Avenue near the Health Cancer Center. Testing is by appointment only and is separated between patients with symptoms and those scheduled for pre-procedural treatments. There are different hours Monday through Saturday, but testing is closed on Sunday.